Welcome everyone, and thanks for showing up at this meeting. And my name is Jennifer Githaiga, and I work in the Division of Social and Behavioral Science in the School of Public Health. And I work with Professor Christopher Colvin, who I'm just about to introduce. A number of you know him, but for those who don't know this mover and shaker, and who can be misled by his cool, calm, and calculating demeanor, Chris Colvin his background is in anthropology, and he is faculty here at the Division of Social and Behavioral Science and also at the University of Virginia. His background is in anthropology. He has three sort of research focus areas: gender and HIV, evidence synthesis, and health activism and community engagement, if you will. And his presentation today combines his second and third areas of interest. That's evidence synthesis and health activism, and it's based on a rapid review that he did of community engagement during COVID-19. So without much further ado, Chris, it's such a pleasure to have you. I know it's very, very early in the US, so thanks for making it in time. And let's over to you.
Great, thanks. Okay, thanks, and good to see everyone. Can you all hear me okay?
We can.
Okay, great, all right.
Yeah.
Okay, so I'm gonna talk about a global review that I was recently part of on community engaged responses to COVID-19. I don't know if the article that we eventually published was circulated, but I'll be speaking to some of the kind of content in that article. Let's see. Okay. So first, a little context for the review. This was something that the Training and Research Support Center in Zimbabwe, along with Equinet, requested. They wanted to collate global evidence on experiences of community engagement and COVID-19. And the initial kind of concern, I think the call for this came out in July, I think, of last year. And the concern was that the early kind of state-led responses to the pandemic either took the form of what was kind of glossed as command and control, kind of top-down, often quite repressive, government responses, or a laissez-faire approach where everyone was kind of left to their own kind of devices. And kind of underlying the concern was, of course, a belief that community engaged responses are both more just in kind of principle, where people are able to participate and to be kind of meaningfully consulted and involved in public health responses, but also more effective when that's done right. When we first started talking about this review, we had to figure out what we meant by community engagement. That's a term that is, at least in our context, more often used to describe the relationship between universities and communities, whatever a community is in your particular project. And there's a whole, literature around the engagement between academics and communities. In community engagement, though, we were interested in a much broader kind of definition, one that didn't necessarily have to involve universities, one that involved a meaningful engagement with mobilization of communities. But it could be that this was a self-organized response by a community. It could be there was an NGO kind of, led response with the community. It could be a state engagement between the community, or some combination of a bunch of different actors. So we had a much broader focus on what community engagement meant than might be kind of normal. And we also decided early on that we were interested in, for lack of a better word, and I still don't think we have a better word, meaningful community engagement. or substantive, something that moves beyond conventional risk communication programs. So when you do a search for community engagement in COVID-19, the vast majority of what you'll find are what's called RCCE programs, risk communication and community engagement. These are important aspects of community engagement. It's important that risk kind of information and communication happen and happen well. But typically, these risk communication programs are pretty one-way, one-direction kind of programs. There might be a little bit of kind of useful community engagement that's part of it, but these are pretty much kind of information and or kind of response coordination via states, kind of programs. And our sense was that that's the vast majority of what's happening in terms of communities' relationship to COVID-19 responses. And so we wanted to know what else was happening. So that's a little bit of the background for the review. Just a quick sketch of the methods. We were interested in globally what was happening. So we didn't have any kind of limitations on that. We were interested within this kind of category of meaningful, beyond risk communication engagement. We identified 4 different types of engagement: strategy, management, decision-making in relation to the pandemic. So this was when communities might be involved in either being consulted on or driving their own kind of active management and strategic kind of decision-making around the pandemic. This was, as you might imagine, a much more rare category, but it was something that came up. The next 3 are a little bit more familiar. Prevention is just involving community members in a wide range of prevention-oriented kind of activities that could include health information, health communication, health promotion kind of work, but it also could include producing PPE or other things. Then the 3rd area was care, so taking care of people who were sick. And then the 4th area was wider social support, so not linked to kind of medical care or health system, but food support or support for victims of domestic violence or whatever the kind of broader social need was. We solicited case studies via the Equinet and the Spaces, or Shapes, sorry, the Shapes emailing list, and received 13 case studies from interested kind of NGOs and academics who wrote in. And then I, along with a couple students, conducted this desktop review, which was quite a rapid systematic review. Obviously, in July, August of last year, there was next to no published literature on community engagement in COVID-19. There was some, surprisingly, that had even, I think, been peer reviewed. But most of what we worked with was NGO reports, newspaper reports, blog posts, academics who might be working on this topic and writing up kind of initial summaries and reports of their experience. But it was a much different evidence base than one might usually use for a systematic review, just given the time constraints. Given what that evidence was, we were mostly only able to kind of collect information, kind of descriptive information, on what kind of activities were happening, and where available, we pulled in kind of explanatory. What are the factors affecting these programs? What kind of impact and how and why did they have that impact? There was some of that, that it could at least be inferred from the material. And we tried to essentially identify kind of common patterns, dynamics, and lessons learned across this material. Just to give you a flavor, again, I can't remember what was sent around, but there is like a 40 or 50 page report that has a page per case study. We ended up with 42 case studies, and we've got kind of a longer technical report that includes a page per case study of these examples that we found. And that's available. And then what we did was to take to summarize those case studies and then do some further kind of analysis and interpretation of the patterns that were coming out. And we published that as an article in Global Public Health. So if those haven't been circulated, I can send them around. Just to give you a little flavor of some of the case studies that we looked at. This is from the table in the article. And I'm just going to take you quickly through a few of these, just to mostly give you a sense of the diversity of things we were looking at. So the first one here is a crowdsourced map of mask availability. Mask availability in Taiwan. This was a government and NGO partnership in the very early days, in kind of February, March, April of last year, identifying, crowdsourcing information about which pharmacies and other stores had masks available. In Yemen, there was a project where women were trained as part of a kind of existing, kind of donor development funded project to produce PPE. In Cameroon, there was an NGO that focused on open science and citizen science, and has been doing that work for a while. And they started developing kind of guidelines for open source prevention kits for producing PPE, including hand sanitizer, but also masks and other things. There were a number of programs. We reviewed one in Malawi and Mozambique for outreach to returning migrant workers. So with the closing of workplaces and the closing of borders, there was quite a massive movement of people across borders who were going back to the countries where they were home. And there was a fair bit of effort to try to kind of test and trace and provide support for these migrants. I'm not sure what you heard about this, but there were some interesting efforts in the US on Native American reservations, where tribal authorities shut their own borders and managed kind of movement in and out. This is usually in the absence of any direction from the state. So these reservations are within states. They have a kind of semi-autonomous status. And in states where there wasn't a clear kind of lockdown or clear guidance from the state, a number of these tribal authorities developed their own responses to govern kind of movement of people and goods. There was doulas weren't allowed to go into hospitals in New York and indeed in most places, and so they built a kind of virtual doula support kind of platform. In Haiti, they trained community disease surveillance teams. So these were kind of community health workers who went out and did testing and surveillance and reported back. In Paraisópolis in Brazil, there was another one of these more kind of self-organized response among residents of an informal settlement who provided kind of emergency and social care to residents. Something I imagine most of you know much more about this than I do, since I've been in the States for the almost entirety of the pandemic. The community action networks. So those are quite an interesting but also fairly well documented set of activities. A lot of these different initiatives were fairly difficult to get kind of real information on, but there was a lot more about the community action networks. And I'll just give you a couple more. Another one which I was involved with from a distance, but much more involved with, was the movement for change in social justice which is a local movement based in Guguletu that I've been a part of for a long time. And they, like the Persepolis example, did a lot of kind of local immediate response to health and kind of social care needs. There were the People's Solidarity Brigades in Europe, which provided mutual aid support. And I'll talk a little bit later about this kind of concept of mutual aid. But these were kind of intentionally non-state, engaged responses. Frena la Curva was a website that crowdsourced across a great kind of swath of Latin America. So this was a website that collected information not only on masks, but on a wide range of other kinds of information that people might be needing across the region. And the last one I'll mention was an indigenous COVID-19 hackathon. So a hackathon is where you get teams together to try to solve a problem by developing some kind of app or platform or kind of technology-based solution. And there was one that was focused on teams representing indigenous communities. And they had one trying to promote the development of kind of tech solutions to the needs of indigenous communities. So you can see there's quite a wide range. We covered 42. We had information on about 150, but purposefully kind of sampled down to a slightly more manageable number. And so this was these were the kind of case studies, quite a wide range of places, sizes, different actors involved, different types of need that were being addressed, different relationships to the state. And so those are some of the issues I'm going to now take you through. I'm just going to quickly survey some of the key review findings. And I'm going to leave, I always talk longer than I expect, but I'm going to leave hopefully 20, 25 minutes for discussion after these findings. And I'm interested in hearing what you all collectively have to bring to the table in terms of what you've seen in terms of kind of community engagement during COVID, how the community engagement you've seen relates to the patterns that we've identified in this review. And what it all means kind of, for public health going forward. So keep that in mind. I'm going to take you through some of the key patterns that we identified in the material we were working with. But I'm going to see if we can have some discussion after about how this relates to community engagement you might have seen or been involved with. So I think there are 4 sections I'm going to cover. And these are, again, just some kind of big picture patterns that we noted across these case studies. The first is that a history of investment in social networks, capacities, organization building, relationship building led to quicker and more effective engagement. In fact, I don't think there were any case studies. Well, that's not true. There were few case studies where organizations, initiatives kind of emerged out of thin air and started providing, support. I think there are a few of those examples, but for the most part, these were at the very least, pre-existing sets of relationships that were activated, if not more kind of formal organizations that were already working. Participatory approaches that were inclusive and made efforts to be inclusive, and use local language and were kind of led by community members, generally led to more effective engagement and more sustained engagement. And the stronger ones, focused on community assets and capabilities. So not only this is a kind of a lens you can take in public health where you look at a community and you don't only see deficits or problems or gaps, you also see what are the assets and capacities in that community that can be mobilized. So let's say that, yeah, that's capacity, equity, and inclusion. New roles and relationships within and beyond. So even though most of the case studies and the most effective case studies tended to be ones that were rooted in some kind of prior, set of relationships or organizations or whatever. Something that was quite distinct across most of the case studies was that this really involved new skills, tasks, roles, and relationships. Right? This is an unprecedented, unprecedented in scale, though not necessarily in kind of particular issues at hand, but in terms of scale, unprecedented. And there was a lot of organizations and networks and individuals had to retool for the response, right? Some of them were involved in health promotion or prevention work that they might not have done as actively before. There was a lot of effort, especially in the early days, to produce locally made PPE because there were global shortages of this. And there are a few examples. This is not it's not unique, but there are a number of examples of local food systems getting reorganized, whether through, and by food system, I mean something more than just soup kitchens or other forms of kind of short-term food aid, but actually at least a temporary restructuring of circulation and distribution and consumption relationships. So farmers working more directly with sometimes households and small community clusters, sometimes working through an NGO. There was a South African case study, Food Flow, I think is the one, where the NGO kind of coordinated new distribution pattern relationships between small-scale farmers and households in need. So, and it's not just in food, but across the case studies, a number of new types of relationships emerging. In all of these, the main actors beyond whatever, the community was, generally speaking, conventionally conceived, right? So some kind of geographically bound set of people who live near each other, who see themselves as a kind of geographic and sometimes ethnic and otherwise community. So by definition, that group of people had to be involved in some way. I don't think there were any case studies of communities who were mobilized and mobilizing themselves without some kind of at least local civil society, NGO kind of support. And often there was quite a lot of NGO support inside and outside, as well as activist and researcher relationships. So these were important across quite a number of groups. International organizations played a role, but it was fairly limited, and it tended to only be in places where these organizations were already actively involved, had an infrastructure, and could take something that they were already doing and retool it as a response to the pandemic. At this time, at least, it may have changed in the year since we did the initial search, but at this time, there weren't any that I found international organizations that had managed to create a new initiative around community engagement. Now, I guess the last caveat there is that there was a lot of international development and public health work around risk communication. So there are plenty of those type of kind of large, globally kind of coordinated efforts, but not beyond that. There are a number of stories about the use of technology, creative use of local apps and social media to collect and disseminate information, to organize collectively and to problem solve collectively. Creation of online learning materials, not only for school children who might be, or most of whom were not able to go to school, but also material, kind of open source science stuff for how to make your own hand sanitizer or how to collect information and report it, etc. A lot of these also enabled new cross-national engagements. I mean, kind of communication technology enables this anyway. but there was a new kind of imagining in some of these case studies of who we need to be in contact with, who is our audience. And the pandemic, forced some of that reconceiving, and the technology enabled some of that kind of new relationship building. And some other kind of themes related to this, the importance of open source technology. I don't think any of the examples that we looked at, were kind of commercially driven or based in proprietary kind of software. All of them had meaningful kind of local development, local R&D, and not surprisingly, these were important, but access barriers, remain in many places that need it most. And then I think the last kind of main area of findings I want to talk about is the relationships with the state. And the first thing I want to say is that the state played an important role in nearly all of the case studies. We did include community engagement work that was led by the state. That was a kind of eligible type of case study. And there were a few of them, but not many. We are also looking. There were quite a number of state-led community engagements that didn't fit our criteria because they weren't meaningfully engaged, right? So there were plenty of state efforts to try to mobilize, educate, engage communities, but they were typically kind of badly done. There were some that were better done, and we included. In most of the case studies, the state wasn't playing a leadership role, but it was actually an important role player in nearly all the case studies. And I think that's in some ways kind of intuitive, but important to kind of remember. There were some case studies where the state was explicitly excluded. These are ones that projects that identified themselves typically as much more on the kind of left of the political spectrum. So this wasn't right-wing kind of get the government out of my hair. It was left-wing, we can't trust the government. We have to organize from below. And so the People Solidarity Brigades were an organized example of that. And more generally, this kind of discourse of mutual aid, of kind of community-based resource sharing, collective support, doesn't necessarily explicitly exclude the state, but is organized around, it's a response that's organized around an idea that we are going to have to take care of each other. And we don't usually do that, and we're going to have to start acting like it. And we have to start looking really locally to see what are the ways that we can take care of each other, right? So that some of these are more politically explicit kind of in their framing, and some are less. But there were some examples where the state was not part of the solution, but there weren't many of them. Effective collaborations are more often at city and local government level when there was buy-in and resources available. So the state's important, but actually the national state, the national level of the government was rarely involved in these kind of examples of meaningful community engagement. It was typically responsive city governments, maybe provincial or state governments that were important partners. And again, this was in places where there was already buy-in, already infrastructure, already resources and networks, where the state had already been working well kind of with communities. In those cases, the state could be quite an important partner. And finally, a theme that came out, not from certainly all the case studies, but from a number of them, was the importance of not having community engagement, community mobilizing work relieve the state of its own duties. So there was some temporary, or framed as temporary, gap filling and communities coming together to provide support in an emergency to each other, but an effort then to try to clarify what was legitimate community responsibility and what was the state responsibility. So yeah, that's a quick discussion of that's a quick review of some of the patterns that we've found in these 42 case studies. And yeah, we've got almost half the time. What I would like to do is to see if we can get some discussion going on these questions. I'll take you through these questions, and then we'll open it up and see what happens. The first one is really just a descriptive, empirical. What kinds of community engagement have you seen or heard about in your own setting, or in other places? It doesn't have to be something you've experienced yourself, but remember, this review was done now almost a year ago. There is a lot more that's happened, even if it's not in your backyard. And so what else do you know about? And how does it compare to the case studies in the review? Are there important differences or similarities? Have you seen an arc or evolution of the forms of community engagement over time? Again, given that this was a fairly early look, is a look at the kind of early part of the response. Second question, have these examples changed how you think about public health or community engagement? Do you think they'll prompt a meaningful or sustainable turn towards a more comprehensive approach to public health? This is a question that comes out of some of the writing that Renee Lowenson and some of the other co-authors on the review have been doing, arguing that the pandemic provides us an inflection point, right? A kind of interruption of the everyday, a kind of unprecedented, once-in-a-generation moment, and things have become more open and dynamic, and now we have an opportunity to push again for a more comprehensive, more progressive, more holistic approach to public health, with community engagement being part of that. So I guess that's a kind of open question, though. That's something that people want to see happen, but are you seeing it happen? And in what areas are you seeing it happen? A related question would be, how do you understand the ideal role of the state and top-down interventions in pandemic response and community engagement? And this question came out of a discussion that I had with some of the other people in the team, all of whom were based in and living in kind of global South at the time, India, South Africa, parts of Latin America. The kind of initial conceit of the review is that the response is too top-down, it's too state-led. We need more community engagement, which I'm in principle can get behind. But at the time, I was living in the US and under the Trump administration's response to COVID, and I would have appreciated more top-down, clear guidance, more forceful kind of intervention by the state. And so we had an interesting, kind of conversation at the time. What is and when is the role of some kind of more coordinated, more enforced, less consulted, more quick, more top-down, state-led response? And it's, again, I don't want to at all frame it as either or, unless you want to argue for either or. But how do we think about the ideal role of the state, especially in something like the classic public health emergency, like a pandemic, which is quite different than what we may be in our regular kind of professional lives working on public health problems. And finally, a kind of related question, what are the leverage points that have emerged that have might help us to sustain some of the positive changes that the pandemic has elicited? So there has been this disruption and reorganization of a lot of practices and ideas and relationships. Some of those are promising. Where are the places do you think that we can kind of sustain some of that change? What are the leverage points for trying to maintain some of the positive kind of developments that have happened? So I wanted to talk through all of those because it doesn't make sense to, try to take each question in order. They kind of speak to each other, and it'd be too awkward. But I wanted to kind of read through and talk you through all four of those, and then open it up now and see what people have to say. I'm quite interested because my knowledge of what's happening, for example, in South Africa is, it's not only the internet. I work still with MCSJ quite closely and others, but I definitely feel a bit cut off in terms of what's been happening day to day on the ground. So with that, I'll leave these questions up and see what you think. Jennifer, do you want to kind of facilitate? I can't see anybody.
I'll look out for your hands. You can raise your hand and just I'll call you out, then you can speak. Philip, thanks.
I'm actually gonna stop presenting because I can't figure out how to see you all, and it bothers me. So there we go. Of course, now I can just see your names are.
All right. Okay. Go, Philip.
During the beginning of the pandemic, I was involved in some community-based screening and testing, which was initiated by government, but really driven on the ground by communities engaging with community leaders to get community members to come for screening and testing. And at the moment, the same community leaders come to me regularly and say, what's happening with registering for vaccination? Why isn't this happening now? Why isn't government engaging with us to register while we're on the ground? So I just wanted to raise that.
Is that something that you feel is a positive in the sense that you had this engagement around the screening and testing, and now they're continuing to kind of engage with you around new problems? Or is it an example of the response falling apart? Or?
So it's a response that was positive initially, and now it's a leverage point. And how do we do this and get back into the community and make use of those structures which were used earlier for registration for vaccination, which having tried to do it for certain community members is not that simple because of how the app is structured.
Right. And I imagine too that it's great to have these initial relationships that can be built on and continue to kind of, help support a response. But I also imagine that the nature of the need might shift in a way that you now can't help, right? Because if you're going in and doing a screening and testing program, or food support, or whatever else it is, and now the problem is vaccines, that may require a whole different set of actors to kind of help with that, or a whole different set of local needs or maybe a different even population of people who need that support. So interesting. Okay, thank you.
Anyone else like to say something? Oh, Diana, go for it.
Hello. You're muted, Diana.
Rookie era. Hi, everyone. Thank you so much, Christopher, for that really informative presentation. I'm a master's student at the UC Graduate School of Business, and I'm actually conducting a study in commemorating community mobilization in a pandemic through collaborative video. So I've approached the CAN here in my neighborhood, which is Woodstock, to engage with them around a collaborative video process to capture their stories and experiences during the hard lockdown. And it's been such a fascinating journey to hear what they've been or what they did and the effects of that engagement. So we've been doing Zoom workshops, conducting in-depth semi-structured interviews, and basically doing this very optimistic video project where we're asking everyone to send through videos or photos that sort of visually outline what they were doing during that time. And this is the 5th month that I've been engaging with this group. And I'd like to just touch upon your comments around pre-existing relationships, because from what I've learned from this group, this specific Woodstock CAN, is that the relationships exist before COVID. And since engaging with the group, the rest of the CAN, the relationships have become so solid that they've translated to offline spaces and to new developments. So someone actually ended up starting an NPO from one of the initiatives she was running during lockdown as part of the CAN. And what I've found from this group specifically is the question around what happens to this CAN, or this community engagement response post-pandemic, if we can imagine such a future, or outside of the pandemic. And when I came in to do the study, it was already at the tail end when the group wasn't meeting as often because people had started returning back to their lives in some kind of way. So this project with the group has ended up being some kind of reflective process. But still remains the question of what happens with the CAN going forward. And in an example that I was interested to see come about was with the horrible fires that happened in Cape Town early in the year. This sort of like dormant CAN group was suddenly like reactivated because the relationship of the CAN that's now been established was lying there ready to now respond to this other crisis of a fire. So now people could ask by name, hey, so-and-so, do you have a truck where we can deliver energades and eye drops? And it was so beautiful to see that happening, this CAN that was lying dormant in regards to the pandemic being reactivated to respond to the crisis of a fire. And I wonder, with these other examples that you mentioned of community engagement responses, how those will exist outside of the pandemic, or do they just fall apart or fall away?
Mm-hmm. Yeah, there's a lot of interesting stuff in there. The thing I'm thinking about, just in relation to your last point, is that there's a similar dilemma that you see often in social movements, where they talk about the NGOization of social movements, where groups of people come together in not spontaneous, but in these kind of complicated, shifting forms of organization to respond to what's come to be identified as an urgent social problem and form a movement of some kind. But the longer that carries on, the more and more institutions stabilize around that, right? And then those institutions have to maintain themselves, and they become projects, so they become organizations, they become NGOs. And I was thinking, once the immediate urgency of the pandemic feels like it's over, how do you maintain a can? You know, do you or do you? And if you do, how do you do that? And there could be a tendency to turn it into a project, to an NGO, to some kind of thing that will have a budget and a staff and a mission statement. People might say, well, no, that's not the purpose of them. They were meant for short-term response, or they're not meant for kind of an organized institutional response. But if you don't have a pandemic, what's going to bring that group together? So I'm interested in hearing what the experience of other cans has been, kind of what their evolution has been in response to the changing kind of perception of the pandemic. I also, I guess, a kind of parallel question was a question about what has been the recent, what was the future of the cans, right, after they initially did their work. But I guess a parallel question too, if anyone has any thoughts, is what were I know there were a bunch of community action networks around the city, and I think in other parts of the country as well. What were the forms that they were based on? What was the kernel kind of, what was the set of relationships or organizations that was the kernel for setting up the can? The can is a name that emerged as a kind of a label for a wide range of initiatives that had some similar features, but they must have had quite different, kind of histories. Each one must be rooted in a different kind of kernel. So I see, Leslie, you've got your hand up.
Thanks, Chris. So here I am in the middle of writing to UCT about how we access vaccination for homeless people living in observatory, which is exactly the question asked earlier. But I think with the cans, as you say, like if there's a focus, it keeps it together. So the observatory can is actually dealing with a ongoing problem of homelessness, which was exacerbated under COVID, but it's a chronic problem. But it's also exhausting. So I know people in the can say, there were a lot of volunteers, a lot of enthusiasm, but they're struggling to keep it up. But they are keeping it up. But the thing that struck me with the vaccination discussion in the townships. Some of the health committees we work with have been complaining. They do their best to try and motivate people to get vaccinated, and then the poor grandmother gets a SMS to go to like Paro from Guguletu, and how can she get there? And they have to rent a bakkie. So what they've done is actually engaged, and they now have weekly meetings with the sub-district officials to talk about how to work together. I couldn't actually imagine doing it in observatory because our local officials are quite creditous, But it seems to me that in the more disadvantaged areas, there's actually a realization that you have to have a structure in place to help this happen. In other areas, people have resources to make it happen on their own. But of course, there's ambivalence on the part of authorities and lack of resources and all the usual problems with participation. But I think it's a sort of moment where I think communities really need to be in charge of making sure that everyone gets vaccinated.
Is that something that others are seeing, that the vaccination kind of pushes, providing another moment to kind of activate cans or other initiatives? Or is it taking a different kind of character in terms of the response? Or any other thoughts about the cans?
I was just going to say something about vaccination in Kenya, something to do with the state. The state was very involved, the top-down issue you are talking about. So at the beginning of COVID, there was a lot of, militarization, literally, people getting whipped and all of that, if you're, it's past curfew time and all that. Yeah. But which is not something entirely new. It's happened before. But when it came now to vaccination, the government pulled back. They talked about vaccination, but they didn't lead by example. So there was an ongoing conversation, and people were saying, this conspiracy theorists were saying, look, until we see the president and his people vaccinated, we are not going. And people boycotted vaccination for some time until the president publicly got vaccinated a few weeks later. And then it's like the doors open, because then people are used, show us, lead by example. So, I mean, that's, the other side of, the state. If you're going to tell us what to do, then show us what to do, because everybody was afraid of that. And the second thing is something else you had touched on about community assets and capabilities, focusing on that. And saying, you had said, they want examples of people who did that without assistance from other organizations. Well, there were media reports of the Maasai community in Kenya, and actually written about that they are so used to being marginalized and doing their own thing, that they heard about, their leaders heard about COVID from the radio and from, on their cell phones, and actually mobilized their communities and started water stations and ordered a cessation of movement, apart from, the cattle and everything, but who actually arose to the occasion. And by the time anybody got to them, which is usually the case with marginalized communities, they already had it going. So I thought that's something that speaks to, resilience in communities that are, we assume, vulnerable and marginalized communities are disempowered. But this is a case of, strength, agency, and resilience.
Right. Yeah, and at the same time, it kind of highlights that dilemma, right? Which is that you wanna understand and support the resilience and assets and capabilities that are there, because you don't want to perpetuate a kind of victim-based passive model of public health, where whoever you is, go in and kind of save people and help people. On the other hand, you need to make sure that the government doesn't take away the lesson that these people are fine because they've organized their own response, and so we don't have to do better by them, right?
Yeah.
Because they've been able to kind of coordinate a response. Yeah, I mean, every time it feels, you start thinking about one of these particular case studies, it quickly gets into these quite, fundamental dilemmas that you kind of face in public health. On the vaccine question, there was a similar balancing act, right? Where we were talking about the mask guidance changing in the US recently. And people not getting vaccinated, and my daughter's response to that conversation was, like a lot of people's probably response, why doesn't the government just do what it's supposed to do and take care of people, which means they just make everyone get vaccinated, right? This is just like, why can't they just do that? And of course, if they try to do that, it's not going to work. I mean, you can go through the kind of range of reasons why that's not a good idea, either practically or ethically or whatever else. But I was wondering, in your case, the Kenyan government seemed to have a different response compared between curfews and vaccines. Did something change politically, or like why?
Things are always changing politically. That's a very wired question.
There've been 3 presidential elections since then.
Yeah. So, well, Leanne, you want to say something? Yeah.
Hi. Thanks so much. Can you hear me?
Yes, we can.
Okay, cool. I'm on my phone. Just wanted to make sure. Thanks, Chris. I think that the kind of idea I wanted to throw into the pot is from another report that's also looked at mutual aid groups, and in particular the engagement with the state. And I guess, my role during the pandemic has been working with the CANs, and then also working to try and make connections between various state actors, given where I also am located in the health department. And one of the ideas that they kind of are throwing around is how, you can have states that are controlling or indifferent or facilitative, and these sort of 3 broad categories. And of course, different parts of the state may fit into different categories or somewhere along the spectrum at different points in time. But I think that what we saw, at least in the beginning of the pandemic, was a window of possibility where there was huge amounts of collaboration between state and non-state actors that could be facilitated through groups like the CANs and others, of course, but I was involved in the CANs. And as that initial moment passed, the opportunity for things to be done differently became less and less. And I think now we're sort of in a very ossified moment where it's actually very hard to do anything different. And I guess given I guess just from where I'm sitting, have sort of been part of these two different worlds, the difficulties in the state behaving differently when almost everything in the bureaucracy is set up to function, I guess, in ways that are counter to what self-organizing or community-based groups would need. You know, we often will talk about how kind of the magic of a self-organizing network can interface with a hierarchy in the Department of Health. And now with vaccination, we're sort of seeing those same things play out. And I guess in part, I guess the point I'm trying to make is that you have a lot of sort of incredible energy that has been reignited through the pandemic. And I think that it sort of from the side of the state, we do need to be thinking much more creatively about how to build a different kind of public service, given how many people are mobilized to build a new society. But I think what I seem to come up against over and over is a lot of people in the state sector as well who really are quite committed to this idea, but are bound by their own institutions in ways that just don't allow them to budge. So I think it is very hard to do. Obviously, we all know this. History has shown us that. But there are these moments in which you can do some things differently and where seeds can be planted of a different way. And I think that's what we saw in the beginning of the pandemic. People were willing. I mean, I remember over and over, people would say, this is not a time for red tape. This is a time for all of us to work beyond our mandates. And that way of thinking, as opposed to the more siloed approach that we so often see, I think was very enabling. But yeah, I think there's a lot of work to be done to kind of harness that energy. But there are also a lot of willing people who do want to make it happen. Yeah, that's me. Over and out.
Yeah, thanks for that. Yeah, I kind of draw two things out from that, which are, I guess, points that are in tension with each other, which is that on one hand, the state is often not facilitating because many states, and especially South African state and a lot of developing kind of LMIC states, are organized around a core logic of kind of, in social science language, like biopolitical administration. Like the job of the state is to administer the population, right? You can do it coercively or technocratically or in a nice or a bad way, but the job of the state is to administer. That doesn't work well with kind of these logics of self-organization, right, and participation. And so on one hand, the whole way that the state is conceived works against that. It's not by any means the way all states work, and there's interesting examples of it being different. But that's a kind of real dilemma. Then I guess the contrasting point is that I've always been fascinated by the ways in which even, frontline activists who are engaged in quite direct confrontation with the state find allies in the state, right? They find those local level, they find those individuals, they find those because the state is not one thing, right? And there are these moments and individuals and opportunities for engaging productively with those spaces and those individuals. And kind of making use of it. I saw that first with the AIDS activism kind of work that I was involved with. So, but thanks for that. I think Jennifer turned her camera on, which I assume it means we're finishing.
I see you have learned some psychology of body language and cameras going on. We've actually run out of time. So we do need to stop. Thank you very much. You can see some of the people on the chat thanking you for an excellent presentation. And Mulongeni is asking if the PowerPoint is available. Maybe we can
I'll send that
connect.
to you, and then that and the reports you and Simpiwe
Yes.
make available.
Okay. All right. So thanks everybody for attending, and Chris, thank you very much for that. Yeah.
Nice to see you all.
Yeah, good to see you too.
Yeah.
Enjoy your summer as we freeze here.
Will do.
Bye-bye.